Hi, my name is Lupe Govea. Welcome to Deep Talk. And today I will be interviewing Dr. James Earl Harris Jr. He is a medical physician. He's a general surgeon for Johns Hopkins. His official title is Medical Director of Johns Community Physicians Practice at Howard County. He's in the city of Baltimore. He's an alumni of Fresno State, which is in the Central Valley in California. He's also an alumni of UCLA Medical School. And for this session, we will talk about his story. And we will be going through a few of the questions. So Dr. Harris, thank you so much for agreeing to do this interview for Deep Talk. Welcome, and let's go ahead and get started with the first question. So tell us a little bit about yourself and about your background.
Well, thanks for having me. I took somewhat of an unusual path to where I am now. As you mentioned, I'm currently working as a general surgeon at Johns Hopkins Community Physicians at Howard County. And, you know, unlike many people who went down the pathway of becoming a surgeon, I went across a road that wasn't as straightforward. I ended up having a tough childhood. I was raised by my grandmother who was disabled and raised me on just welfare and disability. We lived in a pretty rough area of east side of Fresno. And there, you know, my grandmother, you know, was wonderful because she loved me to death, but she didn't have many resources. You know, she didn't have an education. She didn't finish middle school. But because she loved me, I think that was one of the biggest things that I had going for me. That being said, my environment was a tough one, and she wanted to make sure that I got a good education. And at the time, when I was being raised, you could go to school on the good side of town if your grades were good. And I was a pretty smart kid. I was in like GATE classes, you know, gifted and talented education. And my grandmother decided she was going to have me go to the good side of town. So I would take a bus every day to, you know, I actually went to Tenaya Middle School and Gibson Elementary School, which was, you know, completely away from where I was because I was doing well. And what happened with me is that once I got to middle school, I started hearing kids say, oh, well, my parents are saving up money for me to go to this private high school, and they're going to be sending me to college and all this. And I'm thinking, man, my grandmother, you know, just gets, you know, welfare for me. We don't have money for college. So I started thinking, why am I working so hard if, you know, I can't get anywhere with this? So this is where the curveball comes in, is I start really messing up in school. I started getting involved with gangs in middle school, started getting in fights all the time. And, you know, they, you know, if you're not doing well at the school that you're being transferred to, then they make you go back to your side of town. So I ended up having to go back to school on the east side of Fresno, where a lot of the gangs and everything were. And then all of a sudden I started becoming somewhat of a product of my environment. I started getting involved with gangs. I started getting in a lot of fights. I was ditching school all the time. You know, when I got to high school, I went to McLean. I mean, I flunked every class my first year, my freshman year of high school. And at the same time as I'm like, you know, failing all my classes, except one, I take back, I barely passed a science class, which I actually really liked, which is ironic. But, you know, the whole time I had known I wanted to be a physician, but because I didn't know that I had the resources, you know, at the time I didn't really care. But I mean, my grandmother was probably one of the earliest inspirations for me because she had a lot of medical conditions. She had heart problems, and I felt like the cardiologists that were seeing her were kind of the ones keeping her alive, and I gained a lot of respect for them. And then also I had other influences, like, you know, at the time I didn't have any positive role models. So the Cosby Show was also a big influence because, you know, Dr. Huxtable was, you know, he was a positive role model. You know, he didn't have any positive African-American role models at that time, at least within the field of medicine. And even though it was just an acting position, you know, it felt real to me. But anyway, so as I came back to, you know, the bad side of town, I was getting all kinds of trouble during my freshman year. My girlfriend at the time, who's now my wife, Rosina, ends up getting pregnant. And, you know, at the time, you know, I was only 14 years old. She was 16. She took advantage of me. But, you know, it was one of those things that, you know, I had no idea what to do. The only thing I knew is that I wanted to be a good dad for my child who was going to be coming into this world, and the only way I knew how to do it was to at least graduate from high school, so I had to turn things around. That being said, I was so far behind at the time that I couldn't finish on time if I stayed at a regular high school. And at the same time, I also had to work because we didn't have money to buy things like, diapers and, the crib and all these different things. So I ended up having to get multiple jobs working while I was in high school. I was doing 40, 60 hours a week. I was working at Taco Bell. I was working at the Hatchery. I was working at Toys R Us. I was doing all kinds of stuff. And it was around that time that I ended up having to go to Ted C. Will's Restart. I think now it's called J.E. Young, and it's an independent study program. It's in Fresno, and it basically, you go to school, once a week, and you pick up your homework assignments, and then you drop off, and then you just do the same thing. There's no formal teaching. And, because I ditched high school all the time, and I was just going to this, independent study high school, I had really no formal, education. And what I figured out is that I could work full time and I could just copy stuff out of the books and get through the system, and I wasn't really learning anything. I was just getting by. And this counselor who ran into me, his name was Henry Ray at Ted C. Will's Restart, now J.A. Young. He said, James, I see you're getting by here and you're working all these hours at the fast food place, but what are you going to do? What are your plans? And, I told him, I said, hey, what do you want me to do? I'm working full time. I'm doing the best I can. I don't have money for college. So, there's nothing. He was like, what do you mean you don't have money? You don't need money. There's financial aid, there's scholarships, there's loans. No one ever told me about that. And it really opened my eyes. So that was a huge turning point for me, because I went from, not really caring a lot about school and cheating to all of a sudden, okay, I really got to get my act together. So I still was having trouble, but I got through high school. I graduated, and my GPA sucked because it was like, I failed my first couple of years of high school, and then here I am playing catch up. So I don't think I was much better than like a, 2.3 or something. And I was like, how am I going to get into Fresno State? And Henry Ray said, you are going to go talk with Wayne Bird at the EOP office, and he's going to, talk with you, and if he thinks you have potential, you got a chance, you're going to be able to go straight to Fresno State. I didn't think I deserved to go to Fresno State. And somehow Wayne Bird met with me, and he saw something in me and said, you're going to come here and you do whatever it is you want to do. So all of a sudden, that fire that I had within me of wanting to be a physician, it became a little bit more real. I got into Fresno State, and that being said, when I got to Fresno State, I was so far behind because I had cheated my way throughout high school. I was ditching all the time. I had no education. I didn't even know how to add fractions when I got to Fresno State. I barely knew how to read well. I was so behind. I was, speaking, a language that was of the streets. I was so behind. I knew survival talk, and I knew how to count, and that was it. But, so what that meant is that I was dodging the math classes. I was dodging the English classes. So my first semester, I had like a 3.4 because I took all these cool classes that had nothing to do with math, nothing to do with English. And, I thought, wow, I'm doing great. And then that second semester comes around, and here I'm working 60 hours a week. At this time, I'm working full-time at Toys R Us. I'm working full-time at next door to Toys R Us at the Walmart Tire and Lube Express as an auto tech. And I'm doing a graveyard shift at the Zaki Farms hatchery at that time. And it was too much. I think I only had like 9 units at the time. And my English class and my math class, those two that I've been dodging, I was taking at the same time. And I couldn't do it. I was like falling, underwater. I couldn't hang. And I just decided to just stop going, to school. I just quit, and I didn't even withdraw. So I had to, my second semester is Fs, all Fs. And, I decided to focus all my energy on one job, which was the auto tech, and I got promoted to being a service manager when I was like 19 years old. And at that time, that allowed me to make my own schedule, and I decided to go back to school the following semester, and I just went at it, and I figured out, okay, I got to take this math class, I got to take this English class. So what did I do? I found free tutoring at Fresno State, and I found all the resources I could. And when I went to see those guys, they were like, you don't know how to add fractions. I mean, I was so embarrassed, but I had to just humble myself, and I had to just put myself in a position where I had to get help. And, I found free tutoring. I got all the help that I needed. I was able to work my GPA up, and, towards the end, I was getting, 3.4, 3.6, and all of a sudden 4.0, 4.0. So, I had that upward trend, and I figured out how to study. I figured out that it just took a lot of work, and it didn't come easy, but it was hell, but I got through it. And here's applying to medical school. That was the next step. And medical school was, was something that I thought it would be near impossible for me to accomplish because here I am coming from, independent study high school, barely getting into Fresno State, failing my second semester, which I took those classes over, but I didn't actually replace them. So here I am applying to medical school with a full semester of Fs, and then I took the MCAT, and I didn't do very well on the MCAT. I wouldn't say I bombed it, but I definitely was like, the lower percentile, amongst many of the people that were applying. So here I am with these multiple disadvantages, but I did have the advantage of the fact that I had a very strong GPA at the end. At some point, you got to prove yourself. You got to show that you could do it, and that was one thing I had going for me. I'm not trying to promote that people can mess up the way I did and still accomplish getting into medical school, but I just say that, the tenacity that I had and the drive, I think is what pushed me. I applied to like 50 medical schools. I had the Caribbean in my back pocket because I was thinking if I can't get into any medical school, I'm going to apply to the Caribbean, and it's not a way to go. I had DOs in my back pocket, which is nothing wrong with that, but you shouldn't apply as a backup. But I just wanted to be a physician. I was going to do anything that it took, and I think because I came at it with that type of approach, I think that good things happen. I got into UCLA, which was my #1 choice, which was a miracle. And I found out later that there were certain people that I had met with that were really fighting for me because they felt that I had potential, which sometimes I didn't even see for myself. I just knew that I had a family that I wanted to take care of, and I wanted to do everything I could to put myself and them in a good position. So I get in medical school at UCLA, and it was a very emotional time for me because there's so many people that are there for me to help me. And first thing I did is I went and I got a package that I put together with my acceptance letter for medical school, a thank you card, and my whole application for med school, and my transcripts. And I went to Henry Ray. He was the one that basically pointed me in the right direction. And I met with him, and he was still there, same guy. And, it was a very, very emotional time because, it's not very often that people come out of J.E. Young or Tetsy Wills, even graduating from high school, let alone, going to college and then again med school. So I get to med school, and med school was, it was almost like a breeze to me because I didn't have to work full time anymore. Instead of working 40, 60 hours a week, now my whole job is just med school. And it was some of the best years of my life because all I had to do was just focus on what I wanted to do, which was wonderful. I went into med school thinking I wanted to be a cardiologist because those are the guys that I felt were saving my grandmother. And I took surgery as the first rotation as a third year just to get it out of the way because I felt like, surgeons are just technicians. Somebody tells them what to do and they do it, and I did not like that idea. I was like, no, I'm not some monkey who you just tell me how to do something and I'll do it. No, I wanted to be a thinker. I love analyzing different things, and I thought surgeons weren't like that. So I go into my surgery rotation, and I see like second-year residents that are managing patients in the ICU who are on a ventilator. They're on different types of medications to keep their blood pressure up. They're on, insulin drips, all these different things. And I was like, well, where's the medicine doctors that are managing these guys? And I'm like, what are you talking about? I'm taking care of this person. I had no idea that surgeons really thought, I had this biased view. I had no idea what surgeons did. And I started seeing that, the nice thing that surgeons could do is they can manage all these medical issues, which not all do, but many do, and you have the ability to operate, and I found that all the services I was on, the surgeons were the ones that were, not having to call consultants left and right. They were managing a lot of things for themselves, and I thought that was just amazing. So that opened my eyes to surgery, and then I started going on to some of the rotations where I was just, involved in some amazing operations, and I thought, wow, this is great. And I did my mezzanine rotation, and I loved it, but I kept thinking, man, why do we have to keep calling all these people for help? It'd be nice if we could just do it ourselves. And so that's kind of what led me to the dark side of surgery, which I have no regrets about. It's hard work. I tell medical students, don't go into surgery unless you absolutely know there's nothing else that you want to do, because it's a huge commitment. My family fortunately is very understanding, but the training is tough. It's hard. It's long. You don't go into it for the compensation, even though it does pay well. There are other fields that you could go into where you could get paid just as well, if not better, and you don't have to work the crazy hours. But I will say that if you take all that into account and you are willing to go through with the risk of going through the hard training it is so worth it, because what I do is I get to save lives all the time, and it's a beautiful thing. People come to you and they trust you, and they put their lives in your hand, and it's just wonderful. I get to do all kinds of cool operations. I get to see people, get to follow up with a lot of different patients. I get to take out cancers. I get to do all kinds of cool stuff. And I get to manage their medical issues if I want to, and if I need help, then I get the medicine doctor to take care of it. But most of the time, I actually enjoy taking care of my patients and doing everything for them, because I'm a little bit of a control freak. A lot of surgeons are. So that's what takes me to where I am now. I ended up going to Hopkins for my training out of UCLA. I chose to go to Hopkins to train because at the time it was, and still is, considered one of the best, hospitals in the country. And it's got a great history. It's the oldest surgical training program in the country. William Stewart Halstead, who was the first chair of surgery out there, started surgical residency training, and everything kind of started there. And that's what put the United States on the map as far as creating competitive residency training, because before residency, people would go out of medical school and say, oh yeah, I'm a surgeon. You don't want a surgeon straight out of medical school. Trust me, you want somebody who's actually done some extensive training. It's a long time. I mean, it took me 7 years to go through my surgery training after 4 years of med school. Some people think, oh, that's a huge turnoff. I don't want to have to put in this extra time. But the reality is, time's going to pass by no matter what. So, if you want to do something, forget about how long it's going to take. Put your focus on whatever it is you need to do, because it's time's going to go by no matter what. And you might as well, spend your time focusing on what you want to do for the rest of your life, rather than, kind of settling for something less and then being a miserable doctor, So that's what takes me to where I am right now.
Completely agree. I couldn't agree with you more on that last note that you made. And you pretty much talked about, what got you to college and what got you through your professional school, or what got you to where you are now. Now, can you talk a little bit more about what did you do to prepare yourself to have a strong application package for professional school?
Sure. So I was pretty paranoid when I applied because, like I said, I had a pretty rough start. So the biggest thing that I figured out is I had to get my grades together. I mean, you got to prove yourself. You got to have application. They look at everything. They look at your grades. They look at your MCAT scores. They look at your personal statement. They look at your research experience. They look at your volunteer, everything. It's a total package. And, there are even some med schools have a separate committee that will take, certain aspects into consideration that are outside of the typical norm, because some people have a very fantastic application, but they may not have the same grades or the same MCAT scores. That being said, you want to give yourself the best opportunity to do well. So you want to go for the good grades, obviously. You want to go to the best program that you could go to. That goes for undergrad, so you can get into the best medical school. If you're already in undergrad, you got to deal with the place that you have. I came from Fresno State. I think Fresno State is a great program. The downside of Fresno State is that it isn't affiliated immediately with the medical school. There's no medical school in Fresno, which is a shame, because we need a medical school in Fresno. We are affiliated with UCSF, which, there's a UCSF Fresno, but it's, there's not a medical school there, and you just don't have the same connections. The HCOP office is key at Fresno State, and other colleges, may have different types of resource centers where, you have people that can answer all the questions they may have, take you on different, tours, get you the experience, get you, discounts for your MCAT course. That's key. You want to do well on the MCAT, so you got to try to take a course, and you just got to dedicate time to it. My flaw, the reason why I didn't do well on the MCAT, is I didn't put the time in that I should have, because I was working full time. I didn't really have much of a choice. I was, supporting a family. Going in med school, I already had 3 kids. We were married, 3 kids by that time. And, I didn't really have the luxury of taking time off just to focus on the MCAT. I wish I would have. When I went to take my boards and when I was in med school, I took 6 weeks and just focused on my boards, and I killed it. I got 99th percentile for my boards just because I studied. It's that simple. It's not much to it. It's not rocket science. You got to put the time in. You got to treat it like a job. I was like 8 hours a day, 6 days a week, 6 weeks straight, just studying, and I killed it. What do you expect? I mean, anybody can if you put the time in. It's just a matter of, figuring that out. It was the first time I ever did well on a standardized test. It was when I was in med school already. I don't advise that to anyone else. Everyone else, you want to go to med school, you want to do well on the MCAT. I didn't, but anything is possible. You just have to kind of put your mind to it.
And you mentioned earlier that there were some people you found out later that were key in getting you, I guess, or were really pulling for you to get into UCLA. So would you say that that had an effect, or that, affected and somehow impacted your application package?
Yeah, absolutely. I mean, you got to get letters of recommendation. Francisco Pineda was one of my, he was the previous director of the HCOP office at Fresno State. He definitely had a big role, and he wrote a nice letter on my behalf. And it's a lot of times, getting people to speak to others on your behalf. I got to meet a lot of the people at UCLA, and I feel like when I did interview there were certain people that I met who got to know me and got to know my story, who were definitely pulling for me. One in particular, Dr. Isabel Jones, who sat on the Disadvantaged Student Admissions Committee. Not all programs have this, but I got into UCLA through that, not a back door, but it's just another committee that says, wait, let's not just focus on these guys who are just, stellar, perfect GPA, perfect MCAT score. There are other people there who, and even among the disadvantaged, I mean, they are very strict as far as the people that get in through that channel. I don't even think I deserve to get in through that, portal of which I did, but, there's something that they saw in me. I don't know. I mean, I did have a strong trend at the end. I had to prove myself at some point, so, I mean, I was all 4.0 at the end, but overall, I think my GPA going in, applying to med school was like 3.4, if even that. It was a little shy of that, which is, pretty good. But if you were to look at the beginning, you'd be like, oh my God, how is this guy going into medical school with a full semester of, Fs? But the HCOP office helped me a lot. My wife has been, my strength, my backbone the whole way. And I think that both of us, I think we didn't really believe it was going to happen until we got to the point that I was taking the MCAT and other things. Like, oh my God, we're actually really getting close to this. This is going to happen. But, she, helped take care of the kids while I was working full-time and in school full-time, and she was working full-time. So she was my biggest advocate, of course. I give, the most praise to God, because without God, nothing's possible, in my opinion. And for me, I have to have a lot of faith in God, because, I've been through a lot of different difficult challenges in my life, and I think that that's the only way I could get through it, is through my faith. Henry Ray, the counselor at Ted C. Wills Restart, he's the one that first set me off in that direction. So he was the most key individual, I have to say, early on, because I was just thinking about working at the time. I had no idea I could go to college. So I give a lot of credit to him too.
That's great. And that actually really transitions us well into the next question, which is, what do you see as your purpose in life?
Well, gosh, my purpose in life is to be the best person that I can. I have many flaws and many weaknesses, but I pray that I could be the best individual that I can, the best dad that I can, the best husband, the best surgeon, the best physician, the best listener. I had some very difficult challenges throughout residency. And I think that because I've experienced some challenges with my own family, and I've experienced what it's like to be on the side of a family member who's having some trouble, I think that it's given me a lot more compassion as a physician, as a surgeon. I'll admit, going through a rigorous surgical training program makes you a little bit hard and a little bit abrasive. And I think that towards around my 4th year of residency, I was becoming a little bit of a prick. And I think that, because you're very goal-oriented, you're very focused, especially you're dealing with trauma patients and things, you go and you have something you have to do, you don't have time to, be nice and compassionate. And, the first thing I think taught me how I could get things done by being nice is I went to Rwanda during my 4th year. And when I was in Rwanda, there were people dying left and right. I was doing all kinds of crazy cases, but there were people being negligent. And I was like, what the hell are you doing? And I was very mean. And they would freeze up. And they'd be like, and I was like, move, do something. And in the States, if the louder I would get, it seemed like people would listen. And there, everybody would shut down. And I started seeing the senior residents who I was taking through cases, they would be nice and they'd say something. And they'd be like, oh, yeah, let me do this, let me do this. And I was like, crap. You could get things done by being nice. I was like, oh my God. So I opened my eyes to it. And then, I go through a personal thing with, my middle son had a horrible head injury, and I was on the patient side, and I got to see what it was like. And I thought, man, I've come across people who are pricks and people who are really nice, and you really appreciate those people who take the time to listen, to talk to you, and to, just really hear you out and to see you as a person and not just, a patient.
Mm-hmm. Absolutely. Wow. Well, thank you for sharing that. That's really great. And that actually brings us, so you've talked about a little bit of your past, and now let's talk about the future. So where do you see yourself in 5 or 10 years? Can you describe some of the actionable steps that you will take to get there?
Well, my most immediate thing was I was trying to obtain some type of a leadership position, which I'm not even a year out from my residency, and I got this medical director thing out of luck. I don't know how it happened. So that worked out well. So now my next goal is to achieve some other type of a leadership position and to get promoted to associate professor. In academic surgery, everyone starts, well, I shouldn't say everyone. You can either start off in academic surgery as a assistant professor, or you start off as like a teaching assistant or something like that. So I was lucky enough, I had enough research to start off as associate professor or assistant professor. So my next goal is to try to get promoted to associate professor. Usually that takes about 5 to 7 years in an academic setting. Some places they're a little bit more lenient. You could get through it a little quicker depending on how much publications, etc. Being that I'm at a community center, it's a little bit different because I'm still affiliated with Hopkins, and I still every once in a while do operations at the main hospital, so I have close ties. I'll be getting residents now, so I'm trying to focus on things like program building. And my thoughts are, if I could do some clinical research, focus on program building, I'm going to be getting residents soon. Hopefully in 5 years I'll get promoted to associate professor. So I'm still thinking on an academic side of things, how to contribute to, future surgeons. And 10 years from now, gosh, I'd like to be a full professor by then. That would be pretty good. That's around how long it takes to get to full professor, and I probably by that time I see myself growing at Howard County. It's a community hospital, but my goal is to try to build up the residency component because right now we don't have surgical residents there. I'm hoping in 5 to 10 years we're going to have full-time residents. I mean, by next 2 months we're going to have a resident every couple of weeks, so that's already making some progress. But I would like to very much turn it into what one of our other hospitals, Bayview, is like, where we basically run the hospital as residents. The residents take care of everything. They're there 24/7. By having residents in the hospital, it really increases the level of care you can provide to patients because there's somebody there at the drop of a dime. If my patient has a problem now at the hospital, they call me, and if I have to get in there, it takes me half an hour to get there. If there's a resident there, you immediately get to see someone. So you're able to take care of patients that are a little bit sicker when you have residents there because they're there they call them residents because they live there practically. They're in the hospital all the time. So you have someone keeping a very close eye on your patients. And our Hopkins residents are, in my opinion, the best in the country. I'm biased, obviously, because I came from there, and we have fantastic residents. So that's my goal, is to build up the program for me to get promoted to eventually the full professor by 10 years. 20 years from now, I don't know, maybe politics.
Hey, I can see that. I can see that. I will vote for you.
Oh, thank you.
And this brings us to our last question of the broadcast, and then also feel free to add anything else that we might have left off. But what are you most passionate about, and why?
I'm most passionate about my family, doing the best I can and spending the best quality time that I can with them. I'm very fortunate to have a career that I love, and I'm very passionate about my patients and taking care of them and doing the best I can. I treat every patient like I would if it was my own family member, doing the absolute best thing and putting all my focus on them. When I'm in the operating room especially, I don't allow other things to take me away from what I need to do. And when I see patients in the clinic, I focus all my attention on them. So I'm very passionate about taking care of my patients and giving them the best care that I can. And when I'm at home, I'm very passionate about being a husband and a dad and doing the best I can to take care of my family. So, and my faith, my family, and my profession. Those are my three most passionate things that I have going on.
Wow. Well, my goodness. Thank you so much for doing this broadcast and for sharing your story with us. This has been absolutely insightful, and I know our members will be able to really appreciate and gain some, learn something. We will be. Anything else that you want to add?
No, that's about it.
Okay. Well, thank you so much, and we will be signing off.
All right, thanks. Bye-bye.